Today we're going to do a part 2 to the neuralgia video. Now in the first video that I made, which you can watch in the link down below, I went over how to get diagnosed, what the symptoms are for trigeminal neuralgia or just neuralgia in general. Okay, and before I begin, I just want to say, as always, I'm not a doctor. Please consult a licensed healthcare professional for any medical and health related and mental well-being advice. I'm just giving you information that I found helpful for myself in my neuralgia journey and things that I've learned. What am I trying to say? I hope in today's video we will get to cover some common treatment options. I will make several parts of the series, and I'm assuming that in the next part I'll probably mention more treatment options if the original treatment options I mentioned in this video do not really work, as in what would be the next steps for most people if these common treatments don't work. Okay, so let's presume that you got diagnosed with neuralgia, whether it's trigeminal neuralgia or radiculotemporal neuralgia like what I had. What's the first thing that a doctor would do? Well, usually most doctors like to go with the medication route, since that seems to be the least invasive out of all the treatment options. Of course, if medications don't work, there are non-surgical procedures. Some common ones that you may have heard is gamma knife. And another one which I would recommend over gamma knife, because gamma knife to me is a little bit more invasive, would be nerve blocks. So nerve blocks come in other names too. They're basically lidocaine blocks. So a anesthesiologist or a pain specialist will basically take lidocaine and Botox and inject it on trigger points. So sometimes it's also called trigger point therapy. So I promise I'll get to the medication part, but since we're on the subject of nerve blocks, I do want to add that the injector is actually a very important thing. Some doctors will argue, well, lidocaine is just lidocaine, right? Well, not necessarily. Some injectors I've noticed are better at finding the right points. Some injectors have different philosophy in terms of how they do trigger point therapy, or again, like I said, nerve blocks. The one doctor in San Francisco that I highly recommend for nerve blocks would be Dr. Peled. Dr. Zeev Peled. He specializes in headaches. He's actually a plastic surgeon, but he specializes in headache surgery. Now, in this video, I'm not going to cover surgery. I'm just going to mention the nerve blocks and also medication. Dr. Peled does add additional things to his nerve blocks. So I mentioned Dr. Zeev Peled because he adds something into the lidocaine injections that I apologize, I forgot what it's called. I think it starts with a T. But he actually does like a mixture of lidocaine and another substance that helps prolong the effects of the nerve block. If you are in the San Francisco area and you have access to just seeing him for a consultation, he will know the name for it. I don't remember what the name of it is anymore, but if you just tell him, like, what's the thing that you add to nerve blocks that prolong the duration, I think he's going to know what it is, because that's where I used to get my nerve blocks. Sometimes I would pay out of pocket to get nerve blocks from him. And when I was financially strapped, I would just stick with my regular Kaiser doctor. My regular Kaiser doctor is great. Don't get me wrong. It's just that they don't have that extra substance that Dr. Peled used to put in his lidocaine blocks. Okay, now that we got trigger point therapy / nerve blocks out of the way, the other recommendation for treatment doctors give would be, it would start you off with Tegretol or Trileptal. Now, I mentioned those two drugs in the first video that I made about how to get diagnosed for trigeminal neuralgia. Now, these two medications were originally developed for seizures, but they work wonders for a lot of neurological conditions. And so it happened that Trileptal and Tegretol, for whatever reason, would target very specifically to the trigeminal nerve. I'm not sure why. It's kind of like how there are different antibiotics that target different parts of the body or are more effective for certain diseases and conditions. The same is true for seizure medication. So outside of Trileptal and Tegretol, the other medication that they may recommend would be gabapentin. Okay, so for me personally, I found that Tegretol had really intolerable side effects. A lot of dizzy, a lot of nausea, a lot of kind of like heart palpitations. So I had to switch over to Trileptal, and everybody is different. Some bodies work better on Tegretol, some bodies work better on Trileptal. But for me, I found that Trileptal had less side effects. So that was the one that I was on for the longest until I tried other treatment options that helped the pain a little bit better. So like I said, for me, the most effective options were the nerve blocks. But a lot of doctors prefer the medication route. If Trileptal or Tegretol do not work, and it's not a side effect issue. It's just it doesn't really work. The next medication that they may suggest is gabapentin, which is a very broad anti-seizure medication. Okay, now let's talk about gabapentin, and the other drug that if gabapentin doesn't work that doctors prescribe would be Lyrica. So gabapentin and Lyrica, I feel like they belong in a more broad spectrum type of category. I know that doesn't sound very scientific, but what I mean is that gabapentin and Lyrica are both anti-seizure medications that doctors love to prescribe for not just neuralgia, but for migraines too, and other nerve-related conditions. Now, do gabapentin and Lyrica work well for trigeminal neuralgia versus Trileptal and Tegretol? From my personal experience, I feel like both Tegretol and Trileptal worked a lot better. And I know, like I said, every body is different. Some people react horribly to gabapentin and Lyrica, but other people, they find it like a miracle drug for their condition. Personally, I did not like gabapentin, and I haven't touched Lyrica, but from what I've seen in the support groups, a lot of people have really bad side effects with Lyrica. I can't really describe why, but from what I hear, it's very similar symptoms as what I was feeling with Tegretol, but maybe more intensified. So the dizziness, heart palpitation, the sweating, clammy hands, nausea, vertigo. For some people, I had a friend who was on Lyrica, and she didn't have trigeminal neuralgia, but she was using it for, and for her, she said that she just felt cold all the time. She had no energy, and she just felt like she couldn't move or think. Like her judgment was super clouded. I'm not really selling the drug, am I? But I just want to put that out there because from what I've read, more people kind of seem to tolerate Trileptal over all of these medications. So I would go for Trileptal first. So my personal problem with gabapentin was for whatever reason, it made me really wired. And as somebody who has both onset and maintenance insomnia, that was really bad. I was not falling asleep on it. So as a natural result, like, of course, my heart rate will go up because I'm not sleeping. And of course, I would feel sweaty and nauseous and just really tired and fatigued all the time because I wasn't sleeping. So I couldn't tell if it was the drug that was making me feel that way or because I wasn't sleeping, or maybe it was both. But yeah, I remember gabapentin was really bad and I felt like my head was just like always running on anxious mode. Again, I know I'm not really selling the drug, but I assure you, a lot of doctors love gabapentin. Sometimes they would prescribe gabapentin first before Trileptal or Tegretol. I think because it is like kind of a broad spectrum drug that targets a large variety of neurological conditions. So it's like, might as well tackle all the symptoms as you can instead of and then the one of the biggest symptoms, which scares me, I do have the APO3 gene, which is like the Alzheimer's gene, is that all these drugs, they do increase your propensity towards like attention problems, memory problems. So when I say things like, don't quote me on that, I'm just saying it's on the top of my head, or, I have memory problems. I really do mean I have memory problems. I've been tested before. I have memory impairment, but like I'm a high functioning person with memory impairment. And I largely do believe what's causing the memory impairment were the years of being on gabapentin, was the years of having insomnia and all sorts of drugs that just kind of kept me wired. So sleep is definitely important, and unfortunately these drugs may affect sleep too. So I did mention earlier in this video about Gamma Knife, but I'm not going to go there. I don't know why it's still recommended a lot. Maybe because some people do report getting better through Gamma Knife, but from it could possibly cause more nerve pain because your nerves are slightly being damaged to dull the pain, and that increases the risk of more nerves branching out of where the Gamma Knife targets. Now, I'm not going to talk about AD or microvascular decompression surgery because, as we all know, the surgical options are the most invasive. They're like your last resort. So I do believe medications are the most effective in terms of managing the pain. And I did also mention in my first neuralgia video that, all these treatment options that I'm mentioning, it reacts differently from every person's body to other person's body. So some people's bodies, miracle, it takes away the pain. And for other people, like myself, it dulls the pain or limits it from getting worse, but it doesn't make your symptom magically gone and cured. It's just slightly managed better. So that being said, I'm still on medication. I still highly recommend medication. Now, the medication that I'm still on, because to be honest, I'm taking the Trileptal. It was also kind of making me a little wired, but not by too much. Like I said, Trileptal was the medication that I was on probably for the longest to help with my neuralgia. It wasn't a perfect drug. But the one drug that I am on, which is ironically an antidepressant, is amitriptyline. I just stuck with amitriptyline. Amitriptyline also in low doses helps with insomnia. It helps increase delta wave sleep. But again, the key point here is in low doses, because for things like depression, you actually have high doses for amitriptyline. I don't think I'm on a very low dose. I'm kind of like in a moderate dose for amitriptyline. Don't quote me on that. I'm not a doctor again. Just because, something's prescribed as low dose doesn't mean that there's no side effects. Amitriptyline is one of those drugs that are incredibly strong, and we're in a good way about it. It's a very powerful, older class of drugs. It has a long track record, so there is some security in knowing that there's a lot of clinical evidence for amitriptyline. We kind of know the side effect profile for amitriptyline a lot better than other drugs. So in some ways you can say it's safer, but in an ideal world, you shouldn't have to be taking drugs. But unfortunately for people like us, where we live with a chronic condition for life, you do need to take drugs for the rest of your life just to manage and cope with life. So again, it's like you pick and choose your poison. And again, don't get me wrong, I cannot live without amitriptyline. I know that sounds crazy, like, I'm addicted to something, but it's not an addiction per se. It's just that amitriptyline has helped me in so many ways that I can't imagine myself being off of it. And it is also one of those drugs, unfortunately, that if you forget even 10 milligrams of your regular medication, you do get heart palpitations, you get anxiety, you feel like you're going to die, for lack of a better word. So I also unfortunately fear that I'm going to have to be on this drug for life just to cope with everything from the pain and just what the medication brings in, and also my pre-existing. So something else that I think is important to talk about is opioids. A lot of people have this idea, even doctors, especially doctors in the ER, they have this idea that I have neuralgia or just pain of any sort. They think opioids are kind of like the strongest cure-all, which is not true. I mean, I should take that back, because I do know one patient who swears by oxycodone for his neuralgia, but he has occipital neuralgia. For me, I had auricular and zygomatic neuralgia, and I found that opioids really didn't do anything. Opioids just kind of makes you feel really relaxed and high, and it works better on physical muscular chronic pain, but I've never found it to work for nerve pain specifically. But you could try it out. Everybody's different, but that's an option that I wanted to bring up. But of course, we are in an opioid epidemic crisis right now, so it'd be really hard to get that. Okay, my grammar's getting all mixed up. I keep saying have, had, has, all mixed up. But I'm still living with neuralgia, but it's just much more, I have the information, the tools, and the treatment options, and they help me live day by day. So I hope all this information is helpful. If you like this video and you found it helpful, please, if you can, I'm not saying you have to, but if you can, via, I forgot what the option is called, but there should be a donation button. I think it's super thanks on YouTube. If you don't see that donation option, I will put a link to my PayPal donation link below. This information has been helpful, and it will motivate me to continue uploading more videos like this, and hopefully it'll help someone. Okay, this video is getting extremely long, but I did forget to add one more thing. The more like holistic side. A lot of the holistic side is more anecdotal. There's not a lot of clinical studies, but I would say the most effective holistic treatment for neuralgia that I found anyways is CBD with THC. Now, everybody knows that THC is the psychoactive component, and you may think, oh, since CBD is aimed more at pain, like you just get pure CBD. No, pure CBD almost never works for nerve-related issues or neurological-related issues. You do need the THC to cross the blood-brain barrier. So you need the psychoactive component to deliver the CBD to where it's needed around the nerves and your brain. And so when it comes to CBD, my previous neurologist / nurse practitioner actually suggested the 10-to-1 ratio. And that means 10 CBD to 1 parts THC. So I have a really low tolerance for THC. I do not like the feeling of getting high It makes me feel out of control, nauseous, dizzy. I hate that. So what I did was I bought full spectrum CBD, which basically means it's mostly CBD, enough for it to be delivered or shipped legally in the United States, with only an itty bitty amount of THC to help carry the CBD component into your nerves. So I'll put the link down below of a place where I get my full spectrum CBD that I found helpful for my neuralgia. It'll be in the link in the description box below. Now, if you want the stronger stuff, like the stronger stuff that you can only get at the dispensary, again, it's very important the ratio that you get and also the strain. I'm not sure if indica or sativa is if one is sedating, one is like more uplifting. I forgot which one, but you can ask the person at the dispensary. I know not all states have dispensaries, but if your state, marijuana dispensary is legal, then a dispensary is the best place you can get for a 10-to-1 ratio CBD to THC. Pretty much anything that's high CBD and very low THC, but you still need a little bit of THC in it, will help with a little bit with nerve pain. And again, this is something that I felt kind of helped carry on over when medications have been maxed out. But again, talk to your medical professionals and make sure there's no interactions, because they do interact with drugs. So that being said, yes, do ask your doctor if there are interactions between CBD and the drugs you take. My understanding that is depending on how your drug is metabolized, whether it's through the kidney pathways or the liver pathways, CBD may increase the load of your drugs or even decrease it. So it's very important to have a separate time window when you take those two. But again, talk to your doctor. For me, I was able to take the mostly high CBD full spectrum with itty bitty THC, and I would separate it maybe 3 hours in between from my drugs. So always seek your healthcare professional about that. Okay, if you found that helpful, please comment down below, subscribe to this channel if you haven't, share this video with your friends and anyone who's suffering from neuralgia. In my next video, I'll answer your questions, and I may also touch upon my decompression and excision surgery, so stay tuned for that. And yeah, if you give this video a like, it helps motivate me to make more videos like this. And of course, subscribe to this channel if you haven't. All those things really help support this channel, which is very surely needed. I am still, unfortunately, disability, and I'm still struggling to find work with my chronic conditions. So I'm trying to make self-employment work. Please support this channel. It really helps a lot. Thank you so much. Take care. Bye-bye.